Thank you, Lee. That was a wonderful talk. We have time for questions. Over here, if you can walk to the mic and identify yourself, please.
Peter Donnelly from the University of St Andrews in Scotland. Wow, that was worth the airfare. That was seriously. I'd have paid the airfare just to hear that. That was a great talk. You know, thoughtful, articulate, just fabulous. What I was going to try and tempt you just to speculate on a little bit more, though. It does seem to me that one of the problems, and you did touch on this, but one of the problems is that risk aversion is just so common now, particularly across the public sector in the US and the UK. And so funders are risk averse, journal editors are risk averse. Funders in particular would rather give you a very large amount of money so that with a high degree of certainty, you could make a tiny incremental change with surety. And they're happy to leave the hugely more important but difficult questions to one side because they're risky. How do we begin to persuade funders and journal editors to be a little bit more comfortable with risk?
You could give this speech yourself, right? You're so right, and that the critical issue. Let's see. I have to get up so I can see. The critical issue, I think you've put your finger on. It's the funders and the journal editors that have to be influenced, because it's not the practitioners. The practitioners are so eager to take risks because that comes out of their experience that they have to do things a little differently than what's been proven. It's interesting that Don Berwick and Paul Batalden, who have been trying to fight this fight in the medical field, have decided that it's journal editors that they want to start with. And they have proposed a new set of criteria for journal editors to use in accepting articles for peer-reviewed publication, because they feel that it's the timidity of the journal editors that has held us back. The question of how you get funders to think differently about this is one that I think about all the time and haven't got a lot of good answers for. And I keep thinking, you know, if they only knew what they're missing by not taking these risks. And that's why I go around and I talk to them. I'm talking to a group of philanthropists in Los Angeles tomorrow. But that doesn't seem to be enough. I'd love to hear some other ideas from this group about how you persuade funders. And I believe that what OMB has been, the Office of Management and Budget, has been insisting on recently has really had a big effect even on philanthropic funders. And the federal agencies tell you, oh, we'd love to do this. You know, we'd love to have a more expansive home visiting program, but OMB won't let us. So, and of course, OMB is motivated, is understandably motivated by not wanting to see federal funds spent on stuff that doesn't work. And the question is, how do you get them to distinguish between what doesn't work and that not everything that has not been proven doesn't work or won't work in the future?
Eve Sullivan, Parents Forum and the International Federation for Parenting Education. Thank you very much, Dr. Schorr. My question concerns how you engage parents. I'm a practitioner in parent peer support with 20 years of anecdotal evidence that what we're doing is a good thing. And I had a conversation of about half an hour with a woman in South Texas who's implementing our curriculum with a group of ladies in Spanish, and they love it. And she said, well, what do you want from us in the way of data? And I said, well, getting the data shouldn't get in the way of the experience for the parents. So how do you balance that? Because we haven't, maybe you could ask your funders in LA for a wheelbarrow full of money for us so that we could have Sandy Pentland at MIT do the experiment with sociometers. How do you balance the needs of people who want rigorously collected data and people who just want help?
I think it's a constant struggle. And I think that many funders are aware that there is that tension. And I think the answer has to be that there are simpler ways of getting evidence than many of those that are being used. Let me tell you a story about a program called Friends of the Children, where they assign full-time staff to work with very high-risk children starting in first grade, and they stick with them until their adolescence. 6 sites. They got money from the Edna McConnell Clark Foundation to do an evaluation. And one of their sites began to run out of money, and they had to change the model. This was a site in Boston, and because there are many schools of social work in Boston, they decided to try to enlist volunteers who were students of social work to replace the full-time paid staff. And I said, oh, that's exciting. You'll know a great deal about whether that cheaper model is going to work. And the executive of the organization said, no, we won't, because the evaluator tells us that the N is not large enough. And I said, well, you probably know about whether these kids are advancing from grade to grade. You can compare, and whether they're getting into trouble with the juvenile authorities. And you can compare that to what happened last year with the much richer intervention. I think we have to use common sense in trying to learn what we can learn without being absolutely certain. They're never going to be certain unless they do the randomized trial, for which the N wasn't large enough, but they sure are going to learn a lot if they look at their performance data. And the question of, now in parenting, we do have some quite wonderful proven interventions. And I don't know to what extent they have been shown to work in other settings than the US. But let's find out how they figured out that those worked. And let's see if we can simplify the learning a little bit in order to be able to find out what's working, even if we can't find out what's for sure.
Well, thanks for that wonderful talk. Even though I only flew up from Atlanta, it was worth more than the airfare for getting here. And it's wonderful to be able to benefit from your experience and looking at problems in many different fields. One of the problems that we face, I don't know if you were here for our last panel yesterday, where people were talking about what works and what doesn't work in different areas across the lifespan of violence prevention. But we heard a wonderful talk, for example, on intimate partner violence. And so what we heard was that most of the interventions that people have been trying in the prevention of intimate partner violence, when you break them down into fully evaluatable bits, don't seem to work, don't seem to have an effect. So what we're stuck with is having advocates and practitioners who are out there delivering interventions, and at the same time, we have scientists evaluating the interventions and saying, whoa, these may not be working. What do we do to manage in the meantime? How do we reconcile these different findings? How do we continue to progress?
Well, isn't one of the issues, how do we improve our ability to evaluate so that we don't have to slice it up into small pieces? Because we know very often when you slice it up into small pieces, which are evaluatable, it doesn't work. But when you put the pieces together, it may very well have a much bigger effect. And yet, we're not very good yet at figuring out how to evaluate those. So there, I think we don't have this large population of funders, public and private, that we have to persuade. There, it's really the evaluation community. And there are, I think, big strides being made in trying to understand what happens when you put these small slices together that may have a greater effect. How do we learn to measure that?
Arturo?
Hi, thank you very much, Katrina. My name is Arturo Cervantes, and I work for the Ministry of Health in Mexico City. And I took your comments regarding collective efficacy at a different level, considering the perspective of how we can help low and middle income countries move ahead. And I think having worked for the government in a project in Ciudad Juarez, which came to be one of the world's most violent cities. It's a city of about 1.5 million. And the federal government went in together to fight the epidemic of violence. We had months with over 400 victims in just that one city. And the entire government was convened to go work on it. And I think that one of our main lessons after 3 years, this effort started in 2010, and actually homicides went down in that city by close to 80%. As we now speak, homicides are at a monthly low of 20 or 30 homicides. But what's impressive is in two ways. First of all, regarding collective efficacy, I think our main findings, or one of the main conclusions that I can draw from personal experience, is the difficulty that the federal government has in working together with state governments and with municipal governments, and even with sources of funding with agencies such as USAID, which has been very active representing the United States federal government, to address the social determinants, to address the human rights issues that are happening in the community. There is little coordination, and there is little work being done in a very closely knitted strategy, and things happen without much efficacy of the institutions. And there is little evidence that what was done there after a huge investment, there is little evidence that that is what actually fixed the problems. There was major investments dealing with the social determinants of health, of education, of neighborhood environments. But after a 3-year major governmental effort, little has been done because of the context of how low and middle income countries are able to deal with these issues, and because of the human resources that are operating these programs at the local level, such as Tanzania, Nairobi, all these places. We have to consider the context of how these countries are working. And my comment was to bring this out of the discussion that seemed to me very US-centered, in what sorts of resources are also being put in to help collective efficacy at governmental level, at a national and subnational levels actually work. So those were some of my thoughts, and thank you very much.
So you have a success story.
We have a success
and the
story.
problem is that
There's no measurement.
People are not sure why.
Why? And there's major challenges to get people to understand how the mechanisms for violence prevention might work. And also, there is much need to invest in mechanisms that will make governments and organizations that are tackling these problems work together in a more efficient manner.
Well, as I was talking with Mark Rosenberg before the session about how hard it is to get agencies and institutions to work together, and I think that's true everywhere, whether you're talking internationally, you're talking in Mexico, you're talking here. It's such a struggle, but it seems to me having a success story to start with and having to explain success, you can afford a little more uncertainty, and you can, with that success, persuade people that there may be multiple reasons, that it may be a result of the collective efficacy. And that's much harder to do when your change is 1%. But when the change is as big as the one you're talking about, it seems to me more and more efforts to get the message out. Yes, we did a lot of things, and some of the things that happened were probably not our doing, but this is what we certainly contributed to bringing about this success.
Yes, and I'm not saying that the success, that it is a successful strategy. The city certainly is living without as many homicides, probably has little to do with what was done there. But it's important that no measurement is available to put these two things together. And on the other hand,
what you have a clear measurement of results.
Well, of homicides and certain indicators, but just homicides doesn't mean that the domestic violence, the child maltreatment, and all the other factors regarding to violence that were addressed with the interventions went down as well.
So maybe you have to be satisfied with a drop in homicide, a substantial drop in homicide. Not so bad. I wouldn't put that down.
Okay, we're going to go to Tom and then Daniel, and then I think we might move into our next session. Thank you.
Good morning. Tom Feucht from the National Institute of Justice. Thank you, Professor Schorr. It's a treat to meet you and to hear you in person. You've been a real contributor on all these issues. Being from one of the funding agencies, I'd like to be able to propose an answer to the earlier question about what we do with all the funders, but I'm afraid it resembles the recommendation of what we do with all the lawyers. And I want to keep my job. So. But I want to go back to your discussion about tobacco, because I think there's an important lesson there, I think, if I understood what you said. I have a sense that when we evaluate programs and we look to the issue of how evidence travels and external validity and generalizability, that we almost ignore the way in which the playing field changes over time. And I'm guessing you said something about the states and what I wrote down was the early adopters, California and so on, and that other states began looking at those states that were on the forefront. And if we had learned something in California, by the time we get to the next 10 states, the environment for those policies and programs might be rather different than what it was when those programs were initially tested. I would be interested in your thoughts on that.
I think that's a reason why we can't slavishly replicate or clone a strategy. But I think what came out of what Massachusetts and California learned was that they wouldn't succeed with just one single strategy. And I'm sure that the media strategies were different in North Dakota and Mississippi than the ones that were used, although I guess there were some national media strategies. But I remember that I stopped smoking when I became pregnant, and my first visit with the pediatrician, which in those long ago days actually took place in the hospital because you were in the hospital for a whole long time. He said, "Do you smoke?" And I said, "No." And he said, "Don't start again." And I told him I had quit when I became pregnant. And very soon after I got home, I saw one of those great ads where they have a little kid, two little kids dressed up in their parents' clothes. And the caption was, "How do kids learn? They copy their parents. Don't smoke." So I had interventions from two different sources. Now, the way my pediatrician told me to stop smoking and the particular message I learned, those could be different. But the fact that and then the price of cigarettes went up. So I think what they learned from each other actually was good across time and across space, that you had to do many different things at once. And there was a lot of trial and error there about which ones worked. So again, it was a matter of using some judgment without actually being able to clone an intervention.
Hi, Daniel Webster, Johns Hopkins. I want to thank you for your wonderful talk, not only just what you shared with us today, but I've been at Johns Hopkins since '92, and I've been using a lot of what you've been saying, both in my classes on violence prevention, but also in research methods for health policy. A lot of pearls of wisdom that I've tried to hold on to for a long time. So one, I don't have a question, but I want to affirm something by just a shared experience. So Johns Hopkins, I'm part of a center called a Academic Center of Excellence in Youth Violence Prevention, funded by the CDC. I'm thrilled to be part of that, as well as other contributors at Johns Hopkins. It is very interesting the way that program was structured in recent iterations, because it really, in my opinion, goes against what you are promoting, because they were identifying, as the name implies, academic centers of excellence. And what that conjures up to me, of course, is scholarship and thinking, as opposed to sort of mechanistically saying, this had a nice p-value in this study, let's apply it here. And the way the announcement was written is, in order to be funded, you had to have certain elements. And largely it was to demonstrate that you are applying evidence-based interventions to address your problem. Part of that makes sense, of course, but if that's all you're doing, how are you advancing our understanding of these core issues that you're talking about? What works, why, how? If all you are doing is simply applying something that maybe was found decades ago in some very different context. So even though I'm proud of what our center does and many other centers under that, and if you look at some of the evidence that's being applied, you know, it's taking one model that maybe was tested to look broadly at juvenile delinquency in the Pacific Northwest and say, we're going to use that model to look at inner city gun violence in Baltimore or some other setting, or to look at a model developed and tested in Norway and Sweden and say, that's evidence-based, that we have some good rigorous trials there, and we're going to apply that. Is that really advancing our understanding? So I hope that we can start to think bigger And as I loved your words of, in response to Nate Silver, of using judgment, using intelligence rather than just numbers is really going to take us where we need to go.
Amen.
All right. With that, I'm going to hand this over to Jim Murphy to kick off the next panel.